The AT&T network that I have here is showing high noon here this afternoon. I am Lee Bewley. I'm the program director of our Masters in Science Health Administration program. I want to thank you all for joining us today. We're recording this session for folks that perhaps had RSVP'd but whenever were not able to attend live, or of course, if you want to go back and review the session. Today, we're going to go through a brief information session. I have a slide set that addresses a lot of the questions that we have folks that are interested in our Masters in Science Health Administration program, as well as we have a couple of graduate certificates that are associated with our MSHA program. They're courses that are subcomponents of our MSHA curriculum. And so we'll cover that material in about 10 or 15 minutes of slide sets. Also, we want to be able to provide opportunity for any of you that has questions. And so if any questions that you have that we don't address in the information session, happy to address it then. And of course, and I dropped my email there in the chat, lee.bewley@louisville.edu. If you have any follow-up questions after this session or, as you go along the way, please don't hesitate to send me an email. I'm happy to answer any questions you have and help guide you along the way. So without further ado, I'm going to share the slide set. Again, 10, 15 minutes. I'll try to hold myself to that content. Often I maybe get a little too thorough. The classic example of telling somebody how to build a clock when they simply want to know what time it is. And so that's, I guess, a professor's curse, but I'm often so excited about our program. Total time is about 30 minutes, but I'll stay as long as needed to answer any questions you have. And so let me share the slides. All right. Can someone confirm that you see the slide set?
Yep, you're good, sir.
Outstanding. Hey, Brian, good afternoon. I should also acknowledge that I got a critical teammate, Mr. Brian Gwynn, Brian Gwynn. I do that every time. Brian Mathis is our program coordinator. Brian Gwynn, by the way, is an outstanding human being and the director of the MPH program at the University of Louisville. But Mr. Brian Mathis is our program coordinator. I have his contact information later on the slide set. So thank you, Brian. I appreciate it. Ladies and gentlemen, let me take the next 10 or 15 minutes to go over some content for our MSHA program. Again, I'm Lee Bewley. I'm the program director of our MSHA program. I'm a native Kentuckian. I grew up on a family farm here in Kentucky. And like many generations of Bewleys, I ran away from the farm straight to the United States Army. I spent 23 years in the Army Medical Department, first as a Medical Service Corps health administrator and as a combat health support officer. And toward the end of my career, I was a program director and associate dean for graduate programs, but specifically the graduate program that the Army Medical Department conducts to train Army, Navy, Air Force, Coast Guard, VA, healthcare leaders to serve as hospital and health system administrators at the Army Baylor MHA and BA program. I was able to come home and join the team at the University of Louisville here in our School of Public Health and Information Sciences and our Department of Health Management System Sciences and this MSHA program. Very active in the American College of Healthcare Executives since my time back in early 1900s, late 1900s and 1990s as a health administrator in the Army medicine, but more so lately, as a professor to ensure that all of the curriculum components that we have within our MSHA is directly tied to developing leaders who can serve in health organizations now and for the foreseeable future. And also in my role as regent for the Kentucky chapter of the American College of Healthcare Executives and former chapter president, I want to be sure that any resources or connections that our students can enjoy here in the state of Kentucky, but across the whole country. ACHE is a national organization for maintaining and extending the development of healthcare leaders and providing credentialing. I want to be sure that our students and our alumni have access to all of those resources. All right. So you might say, and you come to this like, why healthcare management? Why a career in this field? Well, plainly and simply, the role of a healthcare manager is to effectively and efficiently utilize the resources within their healthcare organization. And in our country, we spend nearly 1/5 of our economy on healthcare. And on one hand, that's great. We invest a lot for health and healthcare, but compared to some other countries and systems, we could do a bit better. And so the role of the future healthcare leader within their own organization or their health system, working in a private organization or public or federal, is to take the resources you have and use them to their greatest effect, efficiently and effectively. In some practical terms, the Bureau of Labor Statistics, 2024 data show that the median income of a healthcare manager is about $118,000. And that's median. It's not the high or the low, but right there in the middle. That is particularly in the context of working with healthcare professionals, docs, nurses, allied health professionals. The team is a great team to work with, highly educated, dedicated to a noble mission of service, but that level of income can provide for yourself and your family. And the rate of growth in healthcare managers, for the foreseeable future is about 29%, which is materially greater than most other health professions and trades across the deal. Now, look, what is the future healthcare leader, healthcare management need to be focused on? Well, one is a population health management perspective, is that going back to those resources that we use, do we use them effectively and efficiently? Are we elevating the level of health in our population? And the population could be the whole country, it could be a region, it could be a metropolitan area, state, or the market or the community directly served by a clinic or a service or a hospital. Is that we focus on the individual patient, but yet we nest that within the context of the population health that patient and those families live. Financing and resourcing is, again, the critical element. I told you that we spend nearly a fifth of our economy in healthcare. And so the new financial models, whether or not it's value-based reimbursement, risk where there's a balancing of contractual obligations to provide care, with specified payments, or old school fee for service or value-based reimbursement through the spectrum, is that new healthcare leaders now and for the foreseeable future must be able to understand and manage those financial models. And by leveraging modern information systems, including artificial intelligence, but general health data analytics, is to see issues emerging, being able to understand how the data that we have can help you and make better informed decisions for your organization, but in the service of providing that cost-effective, cost-efficient services. And then the bottom line is we work with people. We serve people, patients, their families, communities. We work with peers. We work with colleagues. And we need to find those ways that we organize our people, FX, whether or not that's patient care or the organizational perspectives, to being able to achieve organizational mission, to be able to have a group of people that are committed to a dedicated central purpose, and to be able not just to survive or to get to the next paycheck or the next day, but to thrive. And so we, in our estimation, that if we develop leaders, we can be able to serve those community and those people within that we are directly responsible for, but we work within a community of leaders and serving in a way that provides a greater effect and, quite frankly, a more rewarding and enjoyable career. All right, I'm not going to go through all the different roles that a healthcare manager can have, but basically management is planning, organizing, leading, and controlling within organizational plans the different aspects of healthcare outcomes expected with an organizational perspective. Hospitals, health systems, federal, public, pharmaceuticals, entrepreneurship, anywhere that you find any element of healthcare, whether or not it's healthcare financing, healthcare provision, healthcare logistics that has a combination of people, a budget, and an intended need for leadership and management, that is a role that a Master in Science and Health Administration alum could work. And the different roles could start at the operational level as a program, as well as a coordinator, a manager, analyst, or specialist, working your up to director or vice president roles, or CEO, president, COO, CFO. From the perspective in the military and federal service, military, of course, all of the senior non-commissioned officer ranks, the senior officer ranks in the medical fields, within the federal sector, often health system specialists, health administration specialists, program managers are examples of the titles that MSHA alumni hold or can pursue those positions. Look, we think that the Louisville, Kentucky, the University of Louisville Health, our system in our region is a great place to draw examples and to learn, whether or not you're here in the Louisville metropolitan area or you are drawing upon the education from out in the across the country, across the world, is that we have a nexus of healthcare and healthcare delivery that includes urban, suburban, and rural healthcare, major hospitals and health systems and headquarters for healthcare delivery that provides a place to work. It also provides a source of many of our students, but even more so, our part-time lecturers and our advisory board members come from these organizations and ensure that the curriculum that we have and the examples, some of the applications that our students and our alumni work are well vested within a great healthcare community. We're continuing to update the slides. In some cases we need to rotate off. We don't want to get those banners up there, too small. We don't want to miss anyone, but we have MSHA students working across the country, clearly within the Kentuckiana region, Kentucky, Indiana, Ohio, Tennessee, Missouri area, but across the whole world. We have Cardinals from our MSHA program serving. All right. I referenced this earlier before, is that the bottom line is we're looking to build leaders, leaders who can serve competently in reflecting honor, integrity, and professionalism. We address and we reinforce and model those perspectives of how leaders should serve. And our perspective in terms of leadership is that before you assume a position of authority or responsibility, you should be prepared. One of the principles of medical ethics is non-malevolence and beneficence, which is to say that you should seek to do good and to do no harm. That in order to be able to do that, you need to have a good understanding of the responsibilities, the requirements of the work, but also a sense of how you would use past examples, use models of leadership and management, and analytic thinking to be able to solve problems, take advantage of opportunities in the marketplace, or to make things more efficient and more effective. And so that whole perspective of our program is to enhance competence that enables leaders to be able to do something that is special in the marketplace, but sometimes it's increasingly rare, and that is to be able to achieve commitment within your team and avoid just simply compliance or resistance and across your teamwork. All right, just a little bit about the program. We're not going to break our arms patting ourselves on the back, but our school and our department and our program, and most importantly, our students and our alumni of our program have a well-deserved reputation across the country. Currently we're 39th among 164 accredited programs in U.S. News rankings. Our program is accredited by the Commission on Accreditation of Healthcare Management Education. Our school is accredited by CEF, and so that combination of school accreditation at CEF and program CAHME accreditation is a valuable perspective of quality. Look, we're 39th. I believe that is a relatively new program in the marketplace, since that we have even further room to grow. I'll show you in a second some of our student outcomes and competitions and placements, mark us that the trend is up. And so our program is high quality. It's nationally ranked top quartile. And we're not satisfied with that level. We're looking to continue to grow and expand the reputation of the program, to serve both our students that we currently have, but also our alumni as they go out into the marketplace and, compete for more senior roles in the systems. Here's the core slide. MSHA program consists of 43 credit hours. These 43 credit hours are broken up across courses. For those students that come to the program with less than 1 year of organizational experience, you can be admitted to the program, but you would be required to have a practicum, which provides you a basis of experience before you graduate from the program. And so it's a new admissions requirement for those students, and we'll address it a bit earlier. If a student has 1 or more years of organizational experience, preferably in healthcare, you could be admitted regularly, and there is no requirement for a practicum. For those students that have no experience or less than a year of experience, you can also be admitted to the program, but we have a 3 1-credit hour each series of practicum experience. And so either within the organization that you're currently working, if it's healthcare, or a internship or some type of experience-based perspective, a student would complete a practicum, complete the program. The traditional courses, the core courses, what you see there, we have 8-week courses. All students start the program in the fall. And so you see a fall 1, fall 2, fall 1, 8 weeks, fall 2, 8 weeks, transitioning into the spring, 8-week for spring 1, 8-week spring 2. And then in the summer, we have an 8-week term. And so the breaks in the program exist between fall 2 and spring 1. So usually the fall 2 courses in the first week of December. And then that gap of the rest of December and the first week of January is a break. And then between spring 2 and summer, spring 2 usually ends, we end by the Kentucky Derby, the first Saturday in May, which our weekly schedule of 8-week courses is a Monday through Sunday. So roughly speaking, the first week of May, spring 2 is complete. And then the summer 8-week term is basically the month of June and July, those 8 weeks. And there's a little bit of a break between the end of July and the start of fall 1 courses in the 3rd week. And so 3 break periods. You can do the math. There's 5 8-week periods. So 40 weeks of the year, we conduct courses, which leaves a balance of 12 weeks of breaks. The offering of the courses there, we offer 3 courses each of the 8-week terms. And for each student that matriculates into the program, you can have a different cardinal pathway. For students that are dedicated to complete the program as quickly as possible, you could matriculate in the program in fall 1 and then graduate in the following fall, which is about a 17-month period. Most students complete the program in about 2 years, which means that some combination of taking either 1 or 2 courses each of those 8-week terms would result in a 2-year graduation. The University of Louisville will allow up to 5 or 6 years, depending on circumstances, for a student to complete a graduate program. And so if a student wanted to take a slower pace, perhaps 1 course each of the 8 weeks, or they wanted to try to match their employer-based reimbursement, look, I want to take courses, based on the availability of financing from my employer. Or for instance, if we had a military student that were to deploy for 6 months or a year, or someone were to need to take a break, for a health reason or for a professional reason, that flexibility allows folks to, we say, tap on the brakes or mash on the gas and take courses in a way that fits your life and your career plans. And so happy to dive into that a little bit more. But the nature of the courses are progressive. They're all competency based. There's a few courses that have prerequisites. For instance, the health insurance and alternative payment models class. That course is taken after a student has completed health economics and managerial accounting and the health finance and financial management. But on the other hand, other courses like health law and ethics, or the health policy and analysis course, those are courses that can be taken just by themselves. All right, I briefly mentioned the healthcare certificates that we have. We have 3 healthcare certificates. There's healthcare management, healthcare financial management, and healthcare quality and project management. The courses required for those 3 certificates are directly drawn from our MSHA program. And so the question is, if I'm interested in the MSHA, do I need to take the certificates? No, you shouldn't. And I can extend a bit further, is that if you're absolutely certain that you're going to complete the MSHA, just focus on the MSHA. The type of students that are well matched for the certificates would be either someone who comes to the program and says, look, I have a job that is going to be more intense in the financial management, budgeting, or I have a job, I'm going to be a program project manager, or I'm interested in this and being a health administrator or healthcare management. In those 3 cases, you could take one of the certificates. Healthcare management for someone that's new, that they're interested in the field, and perhaps, or they've been working in the field and they're looking for continuing education or a brush up. The healthcare financial management, healthcare quality management, if you have a job or you're looking for that particular focus development, taking that certificate, one of those certificates is right on track. Here's the thing. If you complete one of those certificates or the courses that you complete in a certificate that you enroll, if you earn a grade of A or B and within a 5-year period of having taken that course, you can transfer the credits to the MSHA, but it would be 2 certificates. And so here would be a scenario. You enroll in the healthcare quality and project management certificate, you complete that certificate, you work on project management, you earn A's in all 4 of your courses, 681, 682, 83, and 84. And then you're like, look, I think I want to go for the full degree. You would apply for the MSHA program. In the event that you're admitted, then all of the courses that you completed with a grade of A or B in that certificate program would immediately go towards the MSHA program, and you would not be required to take those courses. All right. So a couple of highlights. I'm going to wrap up our session and open up for Q&A. Again, we are very active participants as a higher education network chapter of the American College of Healthcare Executives, the professional organization of healthcare leaders across the country, hospitals, health systems, federal government, medical logistics, healthcare financing. There is each one of the states, and in some of the more populous states like Illinois, Chicago, California, New York, Texas, Florida, there's multiple chapters within the states. But in our state, Kentucky, we have one chapter. This chapter and each of the chapters have educational events. There's a national meeting of the American College of Healthcare Executives, an annual Congress. We often take students to those conferences. Next year in 2027, March, ACHE Congress is going to be held in Nashville. For the past 2 years, it's been in Houston. Historically, Congress has been held in Chicago, which is the headquarters of ACHE. But in the past few years, they made a move around the country, to open accessibility for folks. And they might work their way back to Chicago. But Nashville for 2027, and I think that they're going to go back to Texas in 28. Look, our students participate in case study and essay contest. We do that, provide an opportunity for students to compete. If they compete and they win show or place, or in some cases come in 4th or 5th, they earn scholarship money, and the students keep the scholarship money. Any fees associated with case study or graduate essay competitions, which in some cases involves travel. For instance, the National Association of Health Service Executives case study competition is going to be held in Los Angeles. Last year it was in Pittsburgh. The University of Alabama, Birmingham has an annual case study competition in Birmingham, Alabama. Ohio State case study competition. There's a number of case study competitions that our students on a voluntary basis compete in these competitions. Any travel fees or registration, the program pays, because we want to see our students go out and to compete. We want to see it's a way for us to do quality assurance. So when our students go out to the field and they compete and they do well, or quite frankly, performance, it gives us feedback to, affirm what we're doing well or what we need to make adjustments. But it also provides a networking opportunity for those students to network with great students at other programs. And the judges of these case study competitions are healthcare executives across the field. It's a chance to get to know these folks and introduce them. Look, because we're a CAHME accredited program, there are a number of national administrative fellowships. An administrative fellowship is a postgraduate developmental opportunity. It's a full-time job, usually for a 12 to 24-month period, in which a major hospital or health system will hire a recent graduate in MSHA program to work a series of projects, from a developmental perspective, to prepare them for a role as a senior manager or director within the health system. And so our program is, comparatively speaking, is very well represented. We have had administrative fellows selected every year for the past several years. We have a healthcare leaders speaker series. So these are virtual presentations from healthcare leaders that we draw upon within our region and our system. They're live sessions and they're voluntary. We record the sessions so that if folks are unable to attend on a live basis and have a Q&A session, they can review. Our faculty are excellent, doctorally educated, a number of former healthcare executives, board certified. We have an executive in residence, the former chief medical officer of Kindred Healthcare, who serves as a a point of contact and as a reference, and prepare you for for interviews, provide some advice and mentoring. Our program is CAHME accredited. We're also very strongly tied to the Association of University Programs of Health Administration. Both CAHME and AUPHA, as well as ACHE, provide scholarship opportunities for current students to be able to apply. Again, 8-week terms is designed for working professionals to focus on fewer courses. Instead of taking 4 or 5 simultaneously, most of our students take 1 or 2 or 3 courses and can focus on those select courses within an 8-week term. There's flexibility. In any given 8-week term, a student could take no courses, 1, 2, or 3, depending upon their flight plan or what's going on in their lives. And we're currently in the process in the summer, of updating our content and our courses. We're incorporating more artificial intelligence within the coursework so that you can use that tool to be to greater effect as a leader or manager, and also is focusing on analytic thinking and population health. All right. I'll close it up here, but I couldn't let this pass. Is that our Cardinals do well? We Cardinal football, soccer, volleyball, basketball teams do well, and so do our MSHA Cardinals. And so a few years ago, we had the national winner for the Stoll Essay Contest. We've had finalists and semifinalists for case study competitions just this year. At the Penn State case study competition, we had a group of students that earned national semifinalist honors. And as I noted before, we have placed a number of our recent grads as administrative fellowships. In fact, right now, Sydney Durbin is getting ready to start her administrative fellowship at the University of Kentucky Health System. All right, so these are our contacts and deadlines. I'm the program director. Our director of student recruitment is Ms. Deepti Jain, and I noted earlier we're on the call here is Mr. Brian Mathis, our program coordinator. You have a QR code if you want to scan to get information sent to you directly. We have all of our students matriculate in the fall for August. We take applications just as soon as an application packet is complete. We'll coordinate for an interview that is with myself and another faculty member. And our focus of our interview, quite frankly, is about fit. We want to make sure that what you're looking for in your graduate education experience is matched with what we're providing. And it gives you, of course, to interview us as well to be sure that this is the right program for you. We have a July 1st application deadline because students start in August. But if there's a student that has an active application that started before July 1st and you need a bit more time to submit some documentation or to be able to coordinate the interview, we will extend that July 1st as needed with coordination. What are the things we need? We need official transcripts, particularly for the institutions in which you have a degree, or that credits that contribute to degree, a updated resume. Again, we're looking for the experience and background, a letter of introduction, also known as a goal statement in 1 page or so. Tell us how this Master's in Science Health Administration degree fits in your life and career goals, and then 3 references. It could be a simple letter. The graduate school also has some forms that folks can fill out directly, but we're just looking for 3 references that, again, comment on your potential for success in graduate school and specifically at MSHA curriculum. All right, I'm going to close out and open it up for sessions. I have our just a couple of highlights there is that, yes, our school is old, 1798. We've got tens of thousands, hundreds of thousands of grads, University of Louisville grads throughout the country and the world. We are going to have a new School of Public Health in a couple of years up there in the top right corner. That's one of our recent alums up there. She's she's Sports Health Administration at Norton Healthcare, and she's there on the Churchill Downs. And then we like to have fun. It's a community. We like to build MSHA community, and so whether or not it's at ACHE Congress or in downtown Louisville for a Cardinal gathering, we like to get together and have fun and build community. And so with that point, I'm going to close this slide set and open up for questions. I think I saw someone raise their hand, so please go for it.
Hi, Lee. I'm Mustaqim Hussain. I'm in nursing school right now. I'm on the ABSN program at Spalding University. And yes, and I'm almost, our graduation has already been done, but I'm still taking one more class over the summer. But I'm really interested in the MHA program that's Louisville's providing. And I'm also an international student, so I have like three questions for you.
All
So
right.
I know it's a full online program, but as for the international students, they're only allowed to uh, be in a hybrid program or an in-person program. So I don't know if that really fits for me, or if you guys can do like a hybrid program
Let
for
let me
me.
uh, let me address that one first. Yes. So here's the thing. That your circumstance is not different than a few. We've had a few other students that would our program is completely, all the courses are offered online, but there are a number of courses like the health policy course, the health economics course. And for the next couple of years, we still have some on-campus evening courses. So yes, you can take some courses in person and online. The degree code would be primarily online, but you could take in-person courses. And then there's um, on an ad hoc basis, what I mean to say is sometimes there can be an independent study. If you needed to take at least one course in person, what we would do in that case is case manage, which is to say, okay, look, if it is one, let me just say this. I am a MSHA program director. I know our VA students and a couple of international students. I think that if at least one course is in person, that meets the guidelines, but I don't know if there's any
Oh,
specific
yeah. Like,
perspectives. And so
so
we do have in-person courses availability.
okay, that's awesome because like a lot of master's program with other universities, what they do is just so that international students can join, they do like a residency program, every semester for 2 days, and they do like in person. So just they can, follow the guidelines of the USCIS and all that stuff.
We
So,
don't, we want you to have a great education and we want to be sure that, we follow whatever rules are there, but there is a way.
okay.
And I think that
That-
we've have at least, and Deep D, and Brian, if you have any insight on this, please, happy to share. But I know that for those select individuals, we case manage their enrollments to make sure that we meet the requirements for the program in terms of being able to stay on the education visa. But clearly, degree completion wise, we want to keep you on track
yeah.
as well.
That's awesome. I'll connect with you later, maybe this week, and we'll discuss more about it. And another question is, like you said, we have to have at least like a year of experience. That's great. If not, then there's like a 3 credit hour of practicum.
So yes,
So,
sir. If you're a nursing student, I bet you probably, if any of your work you've worked in an organization probably will count to that 1 year.
okay,
But on the
because
other
I
hand, I
was
could say this too: if a practicum would help meet that residency requirement, that might also be a way that we could establish a curriculum that will allow you to be able to have a combination of in-person and online courses.
yeah, that sounds good. Like I can take online close courses. It's just that I have to have like 1 or 2 courses in person so that I can follow the guidelines of the,
Absolutely.
USCIS.
Yes, sir.
And then another thing is, what's your start date for your classes in the fall?
I have to look. I don't know
I
it
can
right
look it
off the
up real
top
fast.
of my head. I
Okay.
want to say just Brian, if you see it, I'm going to say it's a probably a August 17th. That's a Monday.
Okay.
Um,
Yeah.
Give or take. It's usually the third week of
Yeah, no, you
August.
were absolutely right. August 17th.
Okay.
All right,
That's
cool.
yeah.
All right, that's the gray
And then
hairs working for me.
Uh, the
and
only
then
thing I
what?
want to add about the international, making sure we're abiding by the regulations, get in contact with the International Student Services Office early just to ensure that they can support you in anything in regards to international applications or processes.
Okay. And another question is, my last question is, how much is the tuition cost for the whole program? And is there like any kind of scholarship grants or,
So
uh,
two things. We follow the University of Louisville online tuition rate. And so I don't know that they've published the updated per credit hour. And so it's simply a matter of the per credit hour times the 43 credit hours. There's so Brian, if you could drop a link in the
Yep.
chat box directly to that.
Just dropped it actually.
All right.
It says 23/2024, but it is pretty accurate. It's just the URL's kind of not up to date, but the information should be correct.
Thank you, sir.
All right, yeah, that's all my question. I'll probably email you, Lee, and then maybe I can start my application and see how far I can go.
Well, I look forward to it. Thank you, sir. It's good to get to know you a little bit better. Looking forward to the follow-on conversations.
All right, thank you. Have a good day.
Welcome. Welcome. Anyone else have any questions? Yeah, Amadou. Hello, sir. It's good to see you again. I can't hear you. I think the microphone is.
Hi, Doctor. Good afternoon.
It's good to see you, sir.
I'm glad to be here. Thank you. Yes, I was waiting for this last session to finalize. Like, I went into my application as you advised me, but it didn't go through. So I started another application, and I was told, no, you have already applied. Then I went to returning users. They said, first-time user. I was like, oh, this is,
It sounds like Brian can go into the system and find where you are. But if you've uploaded the materials, I think you're probably at the point where if you've submitted all the things that we need to coordinate for an admissions interview.
Yeah, I'm checking right now.
Yeah, because
I think. Go ahead, sir.
Sorry, go ahead.
I was going to say our slate is the system. It's just for everybody to know is that when you apply to the University of Louisville, we have a information database, and so each one of the things, the transcripts, the resume, the letters of recommendation, we upload them into the slate system. And as soon as each one of the requirements has been met, then it activates the admissions team and Brian to coordinate for a admissions interview. And so as soon as we get all of the required materials that we need to follow, we can check the status. It sounds like, I think that you probably uploaded the material. The question is there one piece missing? Or, perhaps there's something with the upload.
I guess what I was trying to analyze was, I guess, because I didn't complete the letter of intent, number one. Number two, I submitted 4 references. I had 3.
It's okay.
And then I was in Africa with that internet Glock and all whatnot.
Yes, sir. Oh.
I was like, forget it. So when I went through this, through it, I think last week and even last night, I saw that it was kind of cancelled or denied because I guess because of so many people apply and I didn't complete. Or
let me just say this: we have capacity for the team. Nobody has your slot. If for anybody there, we will fill our sections. And so don't think we haven't stopped the admissions process. Look, we don't have 10,000 students in our program, so we have room. We like to have 25 to 50 students that start the program. We don't want strangers in our MSHA community, so there's plenty of capacity, but we still have room for more MSHA Cardinals. So you have not been canceled. Let me ask Brian to go into the system.
I'm looking at the application right now. It looks like it was for fall 25, like you said, but I see that you've been working on it as of May 26th. Like literally yesterday. I'm going to have to follow up with my supervisor on this because I'm not sure. Because I don't know if we need to defer to fall 26 or if we have to restart the application process. But I do see all your materials. So if you could give me like this week to work on it, we will work on it and I'll get back to you. I'm going to send an email to my boss right now.
Thank you, sir.
Thank you. And then, thank you so much. And then you were talking about experience.
Yes.
At this very moment, I am not employed.
That's fine. Look, we trust that the experience that you have, it's cumulative. And so if you happen to be in between positions, or if you've worked in public